Greetings and welcome to Maine Medical Center's Joint Replacement Center. Our team of fellowship-trained orthopedic joint replacement surgeons combine to perform more hip, knee, and shoulder replacements than any other practice in northern New England. We consistently provide the highest quality care, as demonstrated in our annual Outcomes Guide. This video is intended to give you an understanding of our groundbreaking Next Day Knee program and to help you safely navigate the pre, intra, and post-operative process. The team of professionals we've assembled at our office in Falmouth, Maine, and at the Joint Replacement Center in Portland are dedicated to the singular goal of returning you to a pain-free active lifestyle, doing activities that were once prohibitive due to knee pain. During your first visit to our office in Falmouth, you'll be greeted by a patient service representative who'll check you in and review any forms that may need to be completed prior to the visit. Our specialty-trained X-ray technicians will then capture high-resolution images to identify the underlying cause of your painful knee. Next, a medical assistant will take vital signs and review your medical history and paperwork. The surgeon will then review your clinical history, perform a physical exam, review X-rays, and develop a treatment plan. If conservative measures haven't been successful, and you meet the criteria for a total knee replacement, the surgeon will review the process with you. Following the discussion, a clinical nurse who works directly with the surgeon will review with you a binder that details the flow of the pathway in a step-by-step manner. You'll keep this binder and use it as a playbook and reference for any questions along the way. You'll also be given a prescription for preoperative physical therapy for 1 or 2 sessions. This allows you to develop a relationship with a physical therapist who'll work with you both before and after surgery. Next, our scheduling specialist will work with you to plan the following upcoming appointments: a preoperative history and physical visit, a surgical date, a 2-week post-operative follow-up, and an 8-week post-operative follow-up. The clinical nurse will then work with you to obtain all necessary clearances from your other medical providers, like your primary care physician, dentist, and any specialty physicians, such as a cardiologist or pulmonologist. We've developed a patient educational class at our office in Falmouth that meets multiple times a week to review what to expect during the hospital stay and afterwards. This provides you an opportunity to ask questions and listen to questions from other patients who'll be undergoing a similar experience. Our belief is that the more informed you are prior to surgery, the smoother the process will be. A preoperative history and physical will be performed by a physician's assistant or nurse practitioner who works directly with the surgeon and will review the pathway one final time. In addition, they will go over all medical and surgical history with you and review your preoperative and postoperative medications. This visit typically occurs 2 to 4 weeks prior to surgery. You'll also receive a call from our Preoperative Readiness and Education Program, or PREP. They'll want to speak with you about your medical history from an anesthesia perspective. If you have any questions prior to surgery, you can always call the surgeon's office directly and speak with the dedicated clinical nurse to get consistent and accurate information. Your hospital stay. The day of surgery, you can drive to the main entrance at Maine Medical Center, and a valet will assist you with parking. You'll check in at admitting and be brought up to the Joint Replacement Center. Preoperative nurses will greet you and prepare you for surgery. The anesthesiologist and certified nurse anesthetist will review the anesthesia plan with you. We generally use spinal anesthesia for knee replacement surgery, followed by an additional injection while in recovery to provide extended post-operative discomfort coverage. The surgeon will then mark your knee and answer any last-minute questions. The CRNA and OR nurse will take you to the operating room, where you'll be transferred to an OR table, and the surgical team will work in a coordinated fashion to perform the replacement surgery. The operating room team consists of a close group of professionals that includes the surgeon, the physician assistant or nurse practitioner, an operating room nurse, 2 surgical technicians, the anesthesiologist, and a certified nurse anesthetist. At the time of surgery, we make every measure to obtain the optimal alignment, stability, and motion in a manner that minimizes post-operative swelling and discomfort. We've developed a multimodal pain program that seeks to minimize narcotic use. Following surgery, you'll be taken to the recovery area, or PACU, where nurses oversee your post-operative care for approximately 2 hours before transitioning to your room. When you arrive at your room, a dedicated nurse and CNA will oversee your care. A physical therapist will work with you a few hours after surgery. They will walk with you using your walker and review 2 pages of exercises. Now, the first night in the hospital, you'll need to get up and use the bathroom. Each time you do this, your nurse will walk with you in the hallway. The next morning, the surgeon and PA or NP will make rounds. The physical therapist will be in usually by 9 a.m. They'll walk with you in the hallway and on the stairs in a therapy gym of the Joint Center. A care manager will coordinate home physical therapy. A pharmacist will deliver home medications to your room and review the scheduling for when you should take them. Our goal is to discharge you home around 10 a.m. the day after surgery. There are 3 phases to the recovery after a total knee replacement. First is the healing phase, followed by the motion phase, and finally, the strengthening phase. At home, you'll transition from a walker to a cane after approximately 1 to 2 weeks, and then transition off the cane after another week or 2. We'll see you in the office at the 2-week mark, at which time we'll obtain x-rays and begin outpatient physical therapy. Our next appointment will be at the 8-week mark. Typically by the 3-month mark, patients are 90% recovered. The remaining 10% recovery occurs over the course of the year as you strengthen the muscles about the knee. We hope you find this video helpful in guiding you through Maine Medical Center's Next Day Knee program. As you can see, the process is a team effort, and each member takes great pride in their respective role. We encourage you to review our annual Outcomes Guide. It highlights our hip, knee, and shoulder programs' performance and compares our outcomes with other hospitals regionally and nationally. Thank you.